Good afternoon and welcome to Drug Use on the Coast, examining the opioid epidemic in Maine lobster fishing communities. My name is Becca Bolas and I'm the Executive Director of the Maine Public Health Association. The goal of our webinar series is to feature and promote ongoing public health work in Maine, including accomplishments, current events, programs, and resources. If you're interested in being featured in one of our webinars, please let me know. We would love to have you. Shortly, I will turn it over to Anna Franceschetti, who will be sharing her work assessing opioid use in Maine's lobster fishing communities. Before I do that, I just want to have a couple of housekeeping items. I have everybody on mute just so we make sure there's no background noise. So if you do have questions while the presentation is going on, I will do my best to moderate the session. The way you can ask a question is using the chat feature. So there's a small gray call-out button in the conference call setup. And so if you click on that and type in your questions, I will moderate. We'll try to probably leave most questions to the end with a short break in the middle, just in the interest of time. So I want to thank you very much again for joining us today, and I will now turn it over to Anna.
All right, thanks so much, Becca. As Becca said, my name is Anna Franceschetti, and I'm a recent graduate from Bates College. So while I was at Bates, I studied sociology, and I spent my senior year writing a year-long honors thesis about drug use in Maine's lobster fishing communities. And so today I will be presenting on this work titled Drug Use on the Coast, Examining the Opioid Epidemic in Maine's Lobster Fishing Communities. I would first like to start by acknowledging my advisor, Michael Roque, who made this project possible and provided me with support all along the way. And also as a note that throughout this presentation, I will refer to opioid use disorder, which is defined in the DSM-5 in a more variable way and often as like opioid use. And this is just because literature and participants referred to it this way. And so it just sort of created an easier path while doing my work. All right, so let's start by outlining what we will be discussing today. We will start with background, moving on to key literature, driving questions, methods, results, discussion, theory and implications, limitations, future work, and finally a question and answer period. All right, so let's begin. As I'm sure many of you are aware, deaths due to opioid overdoses are at an all-time high in the United States. The state of Maine alone saw 354 deaths due to opioid overdose in 2017. In response to these alarming statistics, a 10-part series addressing the opioid epidemic was published in the Portland Press Herald in the spring of 2017. So the idea for my project began when I read one of these 10 articles titled Trapped by Heroin, Lobster Industry Struggles with Its Deadly Secret. And this article was written by Penelope Overton. And this article describes how Maine's lobster fishing population was impacted by opioid use. And so I was intrigued and wanted to further examine this phenomenon and took my senior thesis as an opportunity to do so. And so I began my research by reading about drug use in fishing communities and quickly found that there was no empirical literature on the opioid epidemic in the lobstering community specifically. So I relied on a variety of other works to provide a theoretical framework for my literature. And so now I'm just going to sort of highlight a few of the prominent literatures that I used, and if you're interested, I'm happy to send you a full literature review that I wrote later on. So to start, Deaths of Despair literature by Case and Deaton discusses an increasing mortality rate of white working class men due to alcoholism, drug use, and suicide. And so Case and Deaton deem these causes of death as deaths of despair. And this literature is consistent with the economic and demographic makeup of coastal fishing towns in Maine, and therefore is relevant to my research. So next, a book titled Lobster Gangs of Maine by James Atkinson takes an anthropological view of the lobster fishing community And this book describes lobster fishers as highly independent and, quote, the cowboy of the sea. And this work provided me with a general background about the sort of typical or quintessential lobster fisher and was useful in my understanding of the community. Moving on, Agnew's general strain theory outlines that deviant behavior is a product of strain. And so strain occurs for three primary reasons, including blockages of desired goals, withdrawal or loss of valued stimuli, and introduction to negative stimuli. So this literature helped me to sort of understand some of the drivers for drug use in general. Similarly, Akers' social learning theory helps to explain how the social environment can influence drug use and how drug use is learned through four main pathways, including imitation, differential reinforcement, definitions, and differential associations. Moving on now to Putnam's Bowling Alone is a work about America's declining social capital, and it shows again how the social environment can influence drug use. So Putnam defines social capital as, quote, features of social organizations such as networks, norms, social trust that all facilitate coordination and cooperation for mutual benefit. And so interestingly, according to Putnam, social capital is at an all-time low in the United States. And the implications of this are wide-reaching and also have a documented impact on health. For example, low levels of social capital were associated with high levels of drug use and alcohol use. And social capital has also been found to act as a protective factor for drug overdoses. Finally, Keyes et al. Describe why rural America has seen a high concentration of non-medical prescription opioid users. And they sort of go through and outline a four-pronged approach to this. And this literature was really helpful to my work and understanding lobster fishing communities, which are commonly found in rural, isolated areas. All right, so with that sort of knowledge and the literature as a background, I developed the driving questions for my research, and those are as follows. So one is, what are the driving factors or the drivers behind opioid use in the lobster fishing industry, and are these factors community specific? And two, what are effective opioid use prevention and recovery techniques for lobster fishing communities? All right, so to examine these questions, I used a qualitative study design. And so I traveled to 3 lobster fishing towns and conducted 20 in-person as well as over-the-phone semi-structured interviews across the state. And I used the author of the Trapped by Heroin article as the key informant for my literature, or for my methodology, and then I used snowball sampling from there to find and identify more participants. And so interviewees included lobster fishers, both sternmen and captains, legal professionals, healthcare professionals, and community stakeholders. And that's sort of a broad group to describe educators, NGO professionals, community members, etc. And so my hope was, with this wide variation of social roles of the interviewees, that this would allow for a wide range of perspectives on the topic of drug use as it pertains to lobster fishing communities. And so interviews, as I mentioned, were conducted in 3 study sites. So that's one was Booth Bay Harbor, 2 was Deer Isle Stonington, and 3 was Machias and the surrounding areas. And so these communities were identified by their unique attributes, and together were, it was my attempt to encompass the diversity of the lobster fishery. So I'll quickly sort of run through that in a little bit more detail. So the Booth Bay area is the closest to urban areas out of the 3 study sites that I examined, and has the least dependence on the lobster fishery than the other 2 study sites. And then Deer Isle Stonington has the largest annual catches in the entire state, I believe, and of the 3 study sites as well. And further, it's a bridged island, and 81% of households depend on income from lobstering in Lobster Zone C, which is where Deer Isle Stonington is located. Now moving on, Machias has the lowest population density of the 3 study sites and the highest poverty rate, and 77% of households depend on income from the lobstering industry in Lobster Fishing Zone A, which is where Machias is located. So interviews were recorded and later transcribed and coded, and I used the program in vivo to do this. And preliminary themes were identified on my first read-through of the transcripts, and then subsequently sub-themes were identified on the next few iterations and read-throughs. So, and it's also important to note here that all participants consented to being interviewed and signed a consent form, and interview questions were vetted by my college's IRB. Okay, so from conducting all of these interviews, I produced, or lots of results sort of were produced, and it was interesting because a rather consistent story emerged to explain opioid use in the lobster industry. And first, I want to start by discussing the prevalence of opioid use in lobster fishing communities. And though the focus of this project was based on the notion that opioid use is present in the lobstering community, it is important to also recognize that community perceptions of prevalence, of opioid use in the industry. So interviewees pointed to people of all professions and all walks of life as users of opioids. And so one lobster fisher stated, quote, "In this area of the story, the hot story is lobster fishing and heroin. That is not the reality. That's not real. That's not true. Lobster fishing and heroin is a deal. It's an issue, but I'm telling you, in this area, every trade has heroin," end quote. So that's just sort of helpful to give some context to when we're looking at the results, and sort of keep that in mind while we're examining the data more holistically. So moving on to the demographics, it is interesting to note that interviewees commented on the demographics of those who use primarily in regards to age. So other factors such as race, class, and gender were not often mentioned, as the majority of lobster fishers often share the similar demographic features of being white, working class, and male. And also here, as an aside, there has been a rise of female fishers in the industry as of late. And so now let's sort of get into the nitty-gritty of all of this. So discussing the common driving factors of opioid use that that interviewees identified. So these are the drivers for opioid use that were most commonly identified in the lobstering community by the interviewees, and those were making money, boredom, injury, work environment. And here I have listed sort of the number of interviewees that mentioned each one of these themes. And now I'll go and sort of into depth about each of those and sort of to describe what I mean by these sort of common driving factors for opioid use. So to start with money, nearly every participant discussed the large sums of money that lobster fishers make in a short period of time as a driving factor for opioid use. So to quote one interviewee, quote, especially for younger kids, they earn a lot of money at a very early age, so they can afford it. There are kids that are walking around with hundreds of dollars in cash in their pockets all summer long. If you're working at McDonald's for $10 an hour, you can't afford to buy heroin in the same way. So there's this weird thing where they actually can afford it, and the financial burden is not as much of a barrier as it is in some other places, end quote. So now moving on to injury as a driving factor for opioid use. Interviewees often described that individuals started using opioids as a result of receiving prescription opioids to address an injury or physical pain, and subsequently became addicted. So, quote, and it really is hard on your back. I mean, if you're lifting 75-pound traps all day long. But I don't want to be misrepresented. You don't need drugs to lobster fish. Guys do it all the time, but I'm just saying sometimes the work injury that sends you, it's the work injury that sends you to the drugs, you know, end quote. So interviewees also commented on how opioids and their pain numbing effect on the body are able to boost manual laborers' productivity. So another interviewee states, quote, yeah, so when you're on drugs, you can perform more. You know, that's what I found. When I do drugs, I can work longer. I can work harder. And then you got to push longer to make more money to get more drugs, end quote. All right, so now moving on to the work environment. Interviewees suggested that the lobstering work environment provides room for one to sustain a drug habit without immediate consequences. Some describe that this is especially true for steersmen rather than captains who have fewer responsibilities and a great deal of autonomy. One interviewee describes, quote, and it's easy for these guys to hide because they go to work in the dark of morning and they might stumble on the boat and do their thing, end quote. Interviewees also suggested a level of tolerance for drug use within the industry, especially among captains towards steersmen or who are using. And interestingly, some speculated that this could be explained by the lack of available deckhands. And when we're talking about this, I just wanted to highlight that it's important to keep in mind that this is not representative of all lobster boats and the lobster community as a whole. This is just specific stories that have been sort of collected through this thesis work. And finally, I want to discuss boredom. So in the context of boredom, interviewees discussed how the lack of things to do in rural isolated spaces could lead to drug use. They explained the limited options for alternative activities besides partying, as well as limited alternative peer groups contributed to the commencement of use. And this pathway into drug use was described particularly in regards to use in the fishery. And finally, to highlight generational community risk factors sort of surfaced as playing a large role in drug use. And so I define these sort of loosely as generational mental health concerns, trauma, substance abuse more broadly, such as alcoholism, and just sort of how these factors are involved in all steps of the process and influence drug use. Okay, so moving on, I developed a conceptual model to demonstrate the interaction of community-specific drivers for drug use. And so while any one of these factors, making money, boredom, work injury, work environment, and generational community risk factors on their own could demonstrate or describe drug use in many communities, I feel that the convergence of these factors appear to be unique to drug use in the lobster fishing population. And this model runs in a linear manner, so it begins with the two pathways to drug use, and those are boredom and work injury. And so that's ways to begin use, and then once use has been initiated, continued use is supported by two primary mechanisms: work environment and making money. And so this entire system is influenced by generational community risk factors that influence all points of this trajectory. And here with this model, another sort of aside is that this is a preliminary model, and therefore it needs to be further tested and developed. So just keep that in mind when looking at it. And so at this point, that's sort of the first part of the results. So I want to take a pause to see if anyone has any questions so far.
And you can use the chat feature if you do have questions, and I can relay them. And I'm not seeing any questions. I think you can keep going.
Okay, sounds good. All right. So to continue, in answering driving question 2, which was, what are effective opioid use prevention and recovery techniques for lobster fishing communities, there was a variation in the responses given. And this sort of suggested the lack of a cohesive approach to opioid use. However, there was consistency that emerged among the barriers to treatment that participants discussed, and these barriers can in turn shed light onto how to develop better prevention and recovery techniques. So I will now outline each of these barriers that are listed in this chart. So stigma. Interviewees discussed the shame and stigma involved with opioids and with getting help. So one way that they explained this was, for example, that some noted that communities do not discuss opioid overdose deaths in the newspaper obituaries. Other interviewees mentioned that while people are in dire need of treatment for opioid use in their community, stigma prevents patients from seeking treatment. And this was sort of evident to an interviewee as indicated by the beds open in a local treatment facility. In addition, the stigma of asking for help is at play. So one interviewee described this saying, quote, "There's also this intense sense of independence, and people really do have to be able to take care of themselves, and they don't necessarily like asking for help." End quote. Moving on, access to treatment in the geographical sense was a barrier that many interviewees mentioned, and they discussed how that lobster fishing communities are often located in very rural and isolated places that are far from resources, and taking the time from work to get to an appointment that is maybe an hour away isn't always feasible. In addition, access to treatment in terms of affordability was another factor and barrier to treatment that interviewees identified. They stated that many in the fishing industry don't always have insurance, and access to treatment is often very expensive if you're paying out of pocket. Another barrier to treatment and prevention was the efficacy of drug education. Some interviewees mentioned how they felt that drug education programs only went so far and don't work that well. One healthcare professional stated, quote, "It seems like kids have a lot of education, yet they still try that first snorting or injecting, and it's for some of them, after once or twice, that's it. You know, they're done. That's their path, end quote. Finally, many participants expressed frustration with the lack of resources allocated towards the opioid epidemic at the state level, and others felt that leadership in the lobster fishing community has struggled with how to address the opioid epidemic within the industry. Okay, so many participants proposed a variety of solutions to the opioid epidemic, and in this slide, I have aligned those solutions with the common driving factors for opioid use identified earlier in driving question 1. And my thesis goes into more depth here, but these are some takeaways of both interviewees that suggested solutions, as well as combining that with some existing literature. So to begin, in regards to the driving factor of having lots of money and availability of drugs, some interviewees commented that financial literacy was a way to address young people having such large sums of disposable income at one time. And law enforcement was also suggested as a way to cut down on the availability of drugs. Some interviewees mentioned how Booth Bay Harbor, for example, how the police there take a decriminalizing approach to opioid use, and this approach could be brought into other communities and groups, and has really built a sense of trust within that community. So next, let's think about injury. Both interviewees and literature suggested that it is common in rural areas to gain access to drugs through social networks and often family and friends. And therefore, while doctors must be held accountable for overprescribing and understanding the differential effects of opioids from patient to patient, people being prescribed drugs for injury, for example, must also play their part. And that is through educating patients about how to responsibly use drugs and not share. Further, to address work injury, alternatives to opioid use to treat the aches and pains that accompany fishing have been offered to Maine fishing communities in the past. So in 2011, a doctor wrote a piece published in the Fisherman's Voice, a local fishing newspaper, that discussed the dangers of taking opioids while at sea, and also advocated for fishers to use acupuncture as a alternative pain management strategy. And here, many interviewees discussed sort of the lack of insurance as a barrier for treatment for addiction recovery, or not only for addiction recovery, but also as an obstacle to alternative pain management strategies like chiropractic medicine or acupuncture. And now moving on to the work environment, interviewees suggested ways that drug use in the workplace could be decreased. Law enforcement by Marine Patrol as well as Coast Guard were often mentioned as an existing deterrent for drug use. And others reflected that more steps could be taken and that drug testing could be used in the lobster fishing fleet. And over the years, the idea of drug testing has surfaced. For example, at a Lobster Zone Council meeting in November of 2013, quote, there was a discussion, quote, about an idea to have mandatory drug testing for license holders, end quote. And this has never gained a ton of traction, but is something that was mentioned by interviewees. And to address boredom, many participants recognized that suggested sort of funds for recreational centers, providing after-school programs where youth could build relationships with healthy role models, as well as funding coalitions that strive to address opioid use through community-level approaches would be helpful to sort of addressing this idea of the lack of things to do. And if we connect it back to the declining social capital that Putnam described, and these models have been supported in the literature, notably by the Surgeon General's report on alcohol, drugs, and health that notes a protective factor for substance abuse is, quote, opportunities for positive social involvement, end quote. So further, this model has been developed in a program called Communities That Care, and they have worked to build capacity around community involvement, and actually a pilot program has run in the state of Maine. And finally, to address generational community risk factors, participants discussed the need for access to mental health care, as well as sort of broader cultural changes as a way to disrupt the sort of cyclical processes of generational trauma, generational mental illness, generational substance abuse, etc. And before we leave this slide, just an interesting finding from this research was that there were a few community-specific, meaning Lobster community-specific approaches that are sort of already informally used in the fishing community. So some interviewees discussed ways in which they cater care and prevention mechanisms to the lobster fishing population specifically. So, for example, community health professionals commented on the importance of being flexible with scheduling and aware of the non-traditional work hours of the lobster fisher. So one healthcare professional describes this and states, quote, "The lobster fishermen need flexibility. They need to be able to call and say, we're out on the water and we're not going to make it before 4. I'll give them a lot of leeway canceling appointments, but then say to them, if it's a stormy day, call in the morning and we might have openings," end quote. So I just thought that was an important tidbit to mention, that sort of this is a specific, community-specific approaches have already been considered and used with this population. All right, so as we near the end of this presentation, it's important to discuss the limitations of this study. First, the scope is rather limited. There are 20 participants, and therefore there are many voices and opinions that have not been heard or taken into account, and I just want to, stress that. Further, because of the sort of time constraints and situational constraints of participants, interviewees took a semi-structured form. Also, the variety of interviewees and their occupations all sort of made for semi-structured interviews as the way, the methodology that was used in this study. And so with that, there, in some interviews, some themes might have been followed more strongly than others, and this ultimately resulted in non-uniform interviews. And finally, of course, there's the inherent subjective nature of qualitative interviews, the interviewer bias, and then interpretation of data, and that should all be considered when reviewing these results. And so, to conclude with the future in mind, I have a few suggestions for future work. One theme that surprised me and that continually emerged throughout this project was that other fishing industries in Maine were all often pointed to by interviewees as experiencing high rates of drug use. So interviewees often commented that the periwinkle fishing industry, the clamming industry, and the warming industry had more drug use than the lobster industry, and they said this because there was less accountability in those industries. So I think further examination and sort of broadening the scope of this project to include all Maine fisheries would be beneficial. And further, more data. I think that future research should focus on gathering health and substance abuse data by profession in coastal communities as well as across the state. And this data would be helpful in understanding the prevalence of drug use within the lobster fishing community beyond qualitative studies like this one. And quantitative data could really back up qualitative claims and illustrate the need for increased funding and resources to support those struggling with opioid use. And so after having talked to so many people across the state who are both affected and working on opioid use to prevent it, I feel strongly that action must be taken, and I hope that this project, even like just in the slightest way, helps to those who are part of these communities who are struggling with opioid use. So thank you. And now we'll have time for questions.
Thank you, Anna.
Yeah.
Like I said earlier, if you have any questions, please use the call-out box. Okay, Anna, there's one question.
Mm-hmm.
There are a couple questions. Okay, the Substance Abuse and Mental Health Services Administration, or SAMHSA, has identified early use of nicotine, alcohol, and other drugs, previous substance use disorders, childhood trauma, and dropping out of school as key risk factors for opioid use disorders. Were you able to look at how those factors may play an outsized role in lobstering communities?
Well, I think that sort of relates to the generational community risk factors that I discussed, and sort of that was a broad category, and I sort of breezed over that in this presentation, but I think all of those factors play a huge role in the lobster fishing community and any community. And I think one thing that's sort of interesting about, from what my understanding about the lobster fishing industry is sort of the generational nature of it, and how, you know, a lobster fisher may learn from their parent who is also a lobster fisher. And so not only are they learning fishing, but they're also learning any of the other sort of habits that that family member may have. So I think that's one way that those sort of factors fit into the lobster fishing community specifically.
Okay, next question. I know that lobstering workers are on a boat working with their bodies all day. What are they doing with their ears? Is there any opportunity for education with the radio communication network out there or via their cell phones? Just asking because I know there is research and development going on locally about new apps, like sort of like books on tape, that help break down the challenges of seeking treatment.
Wow, that's a really great idea. That's a question that I don't know. I think that you know, I think that could be pursued and would be really exciting work to sort of look into more. From my understanding, I have never really thought about that, but I don't think that they're necessarily listening to anything, so that might be an avenue or a way to sort of spread awareness and address the issue. So I think that talking to lobster fishing associations or communities, that might be the best way to sort of ask about that question. I guess I'm not necessarily the best person to ask, but I think that's a great idea.
Great. Next question. Have you compared Maine rates to rates of opioid use and abuse in other states?
No, I have not, and that's what was sort of tricky about my project because it's really qualitative in nature, so there aren't a lot of quantitative statistics or I'm not looking at like rates necessarily. I'm looking at more sort of trends and patterns of people's stories and understandings of opioid use in their community, less hard statistics. Yeah, but I think that's really important for future work to look into that and compare those rates.
Okay, next question. Very interesting work, thank you. Curious if any of the people you interviewed for this study are drug users.
Yep, a few of them were.
So that was one of your questions? Was that one of your questions?
No, it was more sort of something that was like disclosed at the beginning of the interview.
Okay.
And yeah.
And next question, is there
just to note, those were people who are mostly in recovery.
Okay. Next question, is there a higher prevalence of opioid overdose deaths in those communities aligned with lobster fishers?
Could you repeat that?
Sure. Is there a higher prevalence of opioid overdose deaths in those communities aligned with the lobster fishers?
Oh, I see. Okay. Well, I am not entirely certain about that. It was difficult for me to find data about overdose deaths specific to each community because I was studying towns specifically and those lobster fishing communities, but that would be something that would be really good to follow up on and to look into.
Okay, next question. Have you studied other fishing communities and their rates of opiate use?
No, I have not, but as I mentioned in the end, lots of interviewees mentioned other fishing industries such as periwinkling, clamming, and worming industries as like having substance and drug use prevalent within them. Again, it's hard to talk about prevalence rates. This is more of a qualitative study, but I think it would be really worthwhile to investigate those communities as well.
Great. Okay, next question. Can you explain more about the relationship between boredom and the rates of drug use? Just curious why that is so high on the risk factor list.
Okay, so boredom. So a lot of interviews discussed that especially this was mostly relevant, I believe, to the more rural communities like the Machias area, for example, where especially younger kids, there weren't a lot of healthy sort of alternatives besides sort of the party scene. And so, like, for example, one interviewee discussed how they wish that there was a basketball league or a, like, community center or, like, a YMCA or things like that that people could get involved with. So in their free time, that's where they would sort of focus it rather than the party scene, which these days has sort of been infiltrated, if that's the right term, by opioid use.
Okay. Next question. Sorry if I missed the first part of the discussion. Do you know the age range of those you interviewed? And I'm assuming Deckians tend to be younger. What's the age range?
Okay, yeah. So the age range of, again, my interviewees were all sort of ages because it was such a variety. It was lobster fishers, community health workers, etc. But interviewees generally discussed this population when they were discussing demographics, they would talk about it in terms of age and in terms of like mid-20s young adults. So the younger fishers rather than the older fishers. However, again, this is qualitative. It's hard to say for certain that it was always younger rather than older, but that was the sort of the sense that people felt.
Okay. Next question. May we get copies of this webinar to share? And that's because this person is sitting with a group of colleagues at Penn Bay who are interested.
Yes, absolutely. And actually, so these are just my references, but then here at the end I have a link to my full thesis, and I'm sure you could get a copy of this webinar through the Maine Public Health Association, I'm assuming.
Yes, the webinar will be recorded. I think what will be helpful is also having your the link to your full thesis, but also to the slides, so that is great. There's a lot of thank yous, Anna.
You're welcome.
Any other questions? There is a question, Anna. One question is, how can we help?
That's a great question, and I don't really know if I'm the best person for this, but I think get involved in your local community and find out what sort of action team is addressing opioid use in your community and go from there. And I think there are totally, like sort of what I learned through this whole process is that there are many different ways to address opioid use, and that's not always direct treatment. There's also this sort of bigger layer of prevention, and that can be as one interviewer said, that could be creating a basketball league so people have something to do and focus their time there. Or that could be, you know, creating policy or doing more research or, yeah, there's just a plethora of things that need to be done. And I think, yeah, probably the best place to start is talking with a group in your community who has already done some sort of work addressing the opioid crisis. Great.
Yeah, so just so everybody knows, I will be emailing out the recording as well as Anna's slides. You'll have access to that. And like she said, on this last slide is a link to her full thesis. There is one last comment, which is that perhaps your research and work could help those communities find funding and maybe funding for you to continue doing your research. And then she says, best to you.
Oh, thank you. Yeah, that would be really cool.
Any other questions? Okay, I'm not seeing any come up, so I will stop the recording.